What's up everyone? My name's Dr. Rice and today we're going to be talking all about the heart and exercise. Today's video will be broken down into a few different sections. First, I'll briefly discuss the benefits of regular exercise and the prevention of heart disease. Then I'll dive a little bit into the heart's function during exercise. And finally, I'll talk about the type of cardiovascular training that's most beneficial to maintaining a healthy heart, relating it to the 5 major heart rate training zones. Every year, about 525,000 Americans have their first heart attack. Adults who do not exercise on a regular basis have a 450% increased risk of death from any type of cardiovascular cause. A 2013 study noted that higher levels of physical activity were associated with a 21% decreased risk of coronary artery disease in men and a 28% decreased risk in women. One study looking at a group of patients with heart failure found that regular aerobic exercise at about 60 to 70% of their maximum heart rate 3 to 5 days a week led to overall improved health and an overall significant reduction in their symptoms. These are just 2 of hundreds of studies that demonstrate the overwhelming benefits of regular exercise in the prevention of heart disease. In fact, the best thing you can do to prevent heart disease on a daily basis is to exercise. How do you go about doing this, and why exactly is exercise so dang important for heart health? Well, your heart is actually a muscle that basically functions as a giant pump to circulate blood throughout your body. The purpose of having blood in the first place is to be able to deliver oxygen throughout your entire body to all the tissues that need them. And fun fact, you actually do need oxygen to live. Think of blood as a bunch of taxis that carry their passengers, or in this case, oxygen molecules, around your entire body and drop them off at their respective locations, and the locations being your tissues. During exercise, your muscles are actually working harder than normal. This means they require more oxygen to function properly. The only way to get that increased oxygen to where it needs to go is to create more blood flow in those directions. So in order to get oxygen to where it needs to go, your heart actually begins to pump harder and faster. And this is why you see your heart rate increase during exercise. This in turn leads your left ventricle, or the chamber of your heart responsible for pumping blood throughout your body, to undergo hypertrophy, aka growth, becoming larger and stronger, just like any other muscle would when you train it. Because of this, your heart can get more blood flow throughout the entirety of your body with each pump. This is why when you exercise, the lower your resting heart rate becomes. It has to beat less often to do the same job. Now, in order to train your heart with exercise and get the biggest bang for your buck, if you will, you must first figure out what your maximum heart rate is. Traditionally, the way to figure out your max heart rate is to take 220 minus your age, and that would give you your maximum heart rate. Now, I don't really like this method as much because this is just a pure general average. If you frequently exercise or if you never exercise, your max heart rate can deviate greatly compared to the calculated max heart rate. I would suggest getting a reliable heart rate monitor and pushing yourself to your max, either by sprinting or any other type of aerobic exercise that you go and push yourself to your perceived maximum capability. Then you look back and see what your highest heart rates were during these times, and you can kind of guesstimate your max heart rate that way. Once you find your maximum heart rate, you then use the heart rate training zones in order to base your regular exercise. There are 5 heart rate training zones that I will put on the screen here. The most important heart rate training zones in order to keep your heart healthy are zones 2 and 3, so these are the ones we'll be focusing on. Zone 1 is very light exercise, and this is about 50 to 60% of your maximum heart rate. And then it scales by 10% accordingly. So zone 2 is 60 to 70%, zone 3 is 70 to 80%, zone 4 is 80 to 90%, and then zone 5 is 90 to 100%. In order to maintain heart health, you want to shoot for your heart rate during your workouts to be at least in zones 2 or 3, if not higher. So zone 2 actually improves your blood circulation and your body's efficiency at burning fat. It's recommended to keep your heart rate in zone 2 for general conditioning purposes and for weight control. Zone 3 is where you actually start to see expansion and creation of new blood vessels. You also have increased lung capacity, as well as some overall heart strengthening, leading to overall hypertrophy of that left ventricle that we talked about before. It's recommended to train in this zone for general endurance buildup and tolerance purposes. And then if you want to work harder, or if you're some sort of performance athlete, you really want to shoot to train at some point in zones 4 and 5. But again, as seen on the screen here, you can't really spend a whole lot of time working out in those zones. So according to the American College of Sports Medicine, as well as the American Heart Association, you want to shoot for about 30 to 40 minutes of moderate intensity activity, which would mean in either zone 2 or zone 3, at least 3 to 4 days a week, but preferably every single day. Activities that could get your heart rate in these zones will vary from person to person, but in general, this can be anything from a brisk walk for 30 to 40 minutes at about 4 miles per hour to doing more intense yard work for about the same time frame. I do want to mention though that any length of any given exercise is much better than not doing any exercise at all. And lastly, I think it's important to mention that it doesn't matter whether you only do cardio training or weight training, as long as you're getting your heart rate at least into zones 2 and 3, that will be beneficial for your overall heart health. Thank you so much for checking out this video. If you found this video helpful, please smash that like button, hit subscribe, as well as the bell notification so you never miss a video in the future. If you'd like me to cover a specific topic within the medical field that I haven't covered yet, please leave a comment down below. Again, thank you, and I will see you all on the next one.